Hey there, this is Sarah, the host of Trending Globally.
And this is Dan, Trending Globally's producer.
And we just wanted to say, if you like what you hear, you can get more conversations just like this by subscribing to Trending Globally on Apple Podcasts, Stitcher, Spotify, Google Play, or wherever you listen to podcasts.
And if you've already subscribed, please leave us a rating and review on Apple Podcasts. It really helps others find us.
All right, enjoy the show. From the Watson Institute at Brown University, this is Trending Globally. I'm Sarah Baldwin. What does it actually mean for a state's revenue to dry up? Who's paying for coronavirus testing sites? How are states working together to make sure an outbreak in New York doesn't spread to New England? If you're like me, in addition to getting a crash course on epidemiology right now, you might also be getting a crash course on state and local politics. That's because states have become the political, logistical, and moral center of our nation's pandemic response, especially since the federal government has decided to delegate crisis management.
Yeah, delegate is a diplomatic way to put it.
That's our guest on this episode, Rhode Island General Treasurer Seth Magaziner.
I would say that the federal government, and particularly the Trump administration, have not responded well to this crisis, and as a result, states are having to step up.
Which is why I was so excited to talk with Treasurer Magaziner. In addition to being a passionate public servant, he's an incredible translator of complex legal and financial issues and how they affect the lives of everyday Americans. We started by talking about why Rhode Island has been able to test so much of its population relative to other states. Here's Treasurer Magaziner.
Well, it happened for two reasons. The first is that our governor and our health department have really been hustling. Again, they're having to compete against other states, but they've been very aggressive in trying to secure as much equipment for Rhode Island as possible, including testing equipment and supplies. So big credit to our Department of Health, to the governor. And then the other reason that Rhode Island has had some success at testing is, it helps to have one of the world's largest healthcare companies be headquartered here. And when CVS launched its remote testing site here in Rhode Island, it doubled Rhode Island's testing capacity. So as of the latest data I saw, you're right, we are testing more people per capita in Rhode Island than in any other state. But it's still not enough. It's still not enough to get to a point where testing is available enough and widespread enough that we'll be able to open the economy in a way that is less likely to lead to further flare-ups. So it's good progress, but we still got to keep working.
Are there any states in particular that you find that you're watching closely because they're taking innovative or really effective steps in one direction or another?
Yeah, so ever since this crisis began, I've been in constant touch with other state treasurers around the country. And so I've had a number of conversations with treasurers from around the country that have been very helpful. I know that the governors also have regular calls twice a week, I believe, where they compare notes. And frankly, I'm glad to see that when it does come to easing restrictions and reopening the economy, even though we're not there yet, that states in the Northeast have agreed to take a regional approach so that there's some degree of coordination. And I think that's a very positive development.
Yeah. Can you say a little more about the pact? It's New York, Delaware, Rhode Island, Connecticut, Massachusetts. How quickly did that come together and what's the goal?
Well, again, I think the goal is to have some coordination, right? If all of a sudden one day Massachusetts were to say, well, now we're going to reopen nail salons and barbershops, and Rhode Island hadn't, then you would have a lot of people from Rhode Island flooding the barbershops and nail salons in Massachusetts at the same time that there's pent-up demand from Massachusetts residents, and you would have, potentially a huge crush of people, which is the exact opposite of what you want when you're in an environment like this. And so that's just one of many examples why having some sort of a regional approach to reopening the economy is essential.
Well, let's talk about Rhode Island's economy or financial condition for a moment. Do you foresee borrowing more money in addition to the $35 million so far? And what indicators are you watching to sort of gauge the U.S. economy's condition and Rhode Island economy?
So why don't we take a step back, because there's a lot of different topics that you touch on in that question. So There's really, I think, three separate issues that you raised. The first is the state's cash flow, our ability to actually pay the bills so that our frontline workers get paid and, we're able to procure all of this medical equipment. So there's a cash flow question. There's then also a budget question, which is more of a long-term, what's the impact on state revenue and state expenses going to be over time? And then you also alluded to a more general economic question about the ability of the state's economy to recover from the virus and the necessary social distancing measures that are in place. So let me take those one at a time. Back in early March, when social distancing began to take place, basically our three largest sources of revenue all either dried up or declined significantly all at the same time, which I don't believe has ever happened before, in state history. In Rhode Island, our three largest sources of revenue for the state are, number one, the income tax. And back in early March, the president made the decision to delay the income tax filing deadline from March till July. And so that was hundreds of millions of dollars of revenue that we would normally be collecting right around now that were delayed. The second largest source of revenue is the sales tax, which, due to the shutdowns, declined significantly and very rapidly. And our third largest source of revenue is lottery and casino related revenue, which again, due to the shutdowns, disappeared virtually overnight. And so we were faced with an environment very quickly in early March where our revenues had ground to a halt, and we were facing increased expenses as well on healthcare, on public safety, and on the response to the virus generally. There were times when we were within literally days of running out of money. We were able to secure authority to borrow money for short-term cash flow purposes. We convened what's called the Disaster Emergency Funding Board, which is a board that had never met in state history before,
right,
as far as anyone that I talked to is aware, but that gave the governor and I the authorization that we needed to borrow some money, particularly to get us into the summer when income tax revenues would come in. So we have the authority to borrow up to $300 million. We've actually been able to repay some of that because this week we did get some income tax revenue in, not much, but some. And we also began receiving some federal stimulus funds. In terms of the longer term impact on state budgets, the thing that I know all states, and I know this from talking to other state treasurers and other officials here in Rhode Island and elsewhere, is the big X factor for state budgets long term is going to be how much additional federal aid is provided to states, and even more importantly than how much, what it can be used for. When Congress passed the CARES Act, it included $150 billion of aid directly to state and municipal governments. And Rhode Island, because there was a formula that basically allowed small states to collect more of that aid per capita than larger states, Rhode Island was earmarked for $1.25 billion of state aid in the CARES Act, which is terrific, and big credit to our congressional delegation from Rhode Island for fighting for that. The problem is, Congress said that aid can only be used to cover increased expenditures related to the COVID-19 crisis, and not offset decreased revenues. And when I look at Rhode Island's longer term budget picture over the next months and years, the lost revenue is a much bigger problem than the increased expenditures. We're definitely going to be spending more money as a result of the crisis, right? We're spending money on PPE and medical equipment, as I mentioned earlier. We're spending money setting up 3 temporary field hospitals. When all is said and done, we will be spending hundreds of millions of dollars in Rhode Island on the COVID response. And so having federal support for those expenses is helpful. But the bigger fiscal challenge is the lost revenue, right? Lost sales tax, lost casino and lottery revenue, lost income tax withholdings. that lost revenue could go well into the hundreds of millions of dollars for Rhode Island. And in the absence of federal support, it could force us as a state to make some really tough and not ideal decisions. So what I know that state treasurers and I are lobbying for, the governors are lobbying for, the Rhode Island congressional delegation is on board with this, and what they're lobbying for is they're basically saying, listen, Congress needs to do more to support the states. More funding would be helpful, but what would be even more important is, with the aid that you've already given us, give us more flexibility in how we can use it. Because if we can use that federal stimulus money to offset our lost revenue and not just to cover increased costs, then the budget picture may still be challenging, but it becomes much easier. I was talking to some officials from Oklahoma recently who I know. And, in some of those states, they rely on oil revenue for a significant percentage of their state budgets, right? Oklahoma, Louisiana, Texas, and they're taking a huge hit. So I'm hoping that the pressure from the states will become so great eventually that Congress will give us more flexibility in how this federal aid can be used.
Well, yeah, speaking of that, I mean, we hear a lot about, just to harken back to what you were saying about, bidding wars for ventilators and PPE, we hear a lot about, this sort of states being pitted against each other, but it sounds like there's some realization that everyone's in a similar boat, not the same boat, but that there seems to be a lot of collaboration.
Yeah, no, I'd say that in my experience, many states are collaborating with each other to the greatest extent that we can. But again, it would be easier if there was a more robust federal response, and states are still having to compete. I'm reminded when I was in business school, I had a professor who had this word that he claimed that he coined called coopetition, and where sometimes you have environments where multiple parties cooperate on some things and compete on others, and I think that's the environment that we find ourselves in now. As states, there are aspects of the COVID response where we are collaborating with each other. Then there are also aspects where, unfortunately, we're forced to compete. So
what is it like to be you right now? Are you breathing any easier than you were in March?
Well, so unusual and surreal times in our office, just like for, I think, every Rhode Islander and every American. It's been very hectic. It's been very busy, but I'm proud of my team, and I'm proud that we've been able to find some real fixes, at least to the most immediate challenges that we faced. But certainly challenges remain. And one of the things that's been, sort of part of this new normal is every day you wake up and you don't know what fire there's going to be to put out, right? So, you wake up one day and you get a call that, maybe the hospitals are facing budget issues and they need help. And then you wake up another day and, there's an issue with drawing down federal stimulus money, and the list goes on. And then there are those days that are eerily quiet and still busy. There's still work to do, but, there's no crisis that day. And so it's kind of like, so you just got to kind of roll with it. But, what I find is helpful is having a good team. And for me, as the leader of our office, making very clear what our priorities are. So in the treasurer's office, we are not healthcare experts, and we don't try to be, right? Our job is to manage the budgetary and fiscal response to this. People are reaching out to our office all the time, like, hey, I think I have a lead on a place that will sell masks, or I think I have an idea of some new treatment. And we say, great, go talk to the health department. Like, that's them. That's, because if you try to go too far outside your lane, not only will you be less effective at your core duties, but you also won't be very good at the stuff outside your lane. And so that's something that I've tried to be mindful of, is making sure that our team knows, all right, like, these are our things that we are accountable for, that we're going to focus on, and stick to that so that we do the job that we were put into office to do.
A lot of our listeners are college students, and I wonder if you're working on anything in particular that would be of interest to them.
So one of the issues that I've spent a lot of time on even before the COVID-19 crisis began was we have a real crisis with student loan debt in this country. And there's a number of facets to that. And this is something that even if your students aren't currently grappling with it, many of them will be in the near future when those bills start to come due. But one area in particular that I've been focusing on is student loan servicing, which is a very poorly regulated industry that, unfortunately, in my judgment, is hurting a lot of people. So the student loan servicers, they're not the lenders, but they're essentially the debt collectors, right? They're the ones that process the payments. And as I mentioned earlier, it's a very poorly regulated industry. There are frequent glitches. And these can have really significant impacts. So, for example, if you work in the nonprofit industry or you work in government, you could be eligible for public service loan forgiveness, which is a program where if you work in nonprofit service or government service for 10 years and you make your loan payments for 10 years, whatever's left at the end of those 10 years is supposed to be forgiven. This is written into federal law. It was signed into law by President Bush. If you have a federal student loan, you're eligible for public service loan forgiveness. A couple of years ago, the first cohort of people finished their 10 years and applied for their loan forgiveness, and the rejection rate was 99.5%.
Oh my God.
Why? Usually because the servicers had messed something up. They had either 1 month taken the wrong amount or not enough or skipped a couple months. Because keep in mind, if the loan is forgiven, the servicers stop getting paid. And that's just one of many, many examples. So last year, we passed a law in Rhode Island called the Student Loan Bill of Rights to crack down on these poor student loan servicing practices, basically setting up a whole set of standards for loan servicing in Rhode Island. If the servicer gets it wrong, they can be liable for making the borrower whole if the borrower has experienced financial stress as a result. And actually, just in the next couple of weeks, we're going to be launching a website where Rhode Islanders with student loans can see their rights, can log a complaint if they feel that their servicer has done something wrong. And we've trained the staff at the Attorney General's office to investigate those student loan complaints so that if borrowers have been wronged, the Attorney General's office can help them get compensated for it. Student loan issues are becoming, again, even more timely now because you have a lot of people with student loans who have lost their jobs or are unable to find work. And so we've been trying to let people with student loans know what types of relief are available. It's an issue that we care very much about and trying to protect people from some of these bad actors out there.
Speaking of college, you went to Brown. When you were a Brown student, did you envision becoming General Treasurer of the state of Rhode Island? How did you get from there to here?
I really didn't. I was always interested in government. I was involved with the College Democrats when I was at Brown. But I wasn't a political science major or anything like that. And
what was your major?
I was history. I was a history major. And I wasn't, I didn't have much of an interest in finance when I was at Brown either. After Brown, I actually started out my career as a teacher. I was a public school teacher. I moved to rural Louisiana and taught school there in a small town called Opelousas, Louisiana. And I was down there, I got down there in 2006. I was down there 2006, 7, 8. But I was down there and, it kind of dawned on me that there were policy decisions that were being made that were having a really negative, severe impact on the lives of my students and their families. Our school district was still essentially segregated. There was actually a federal Department of Justice lawsuit open against our school district while I was down there around desegregation. Even in 2008, my elementary school was predominantly African-American, the students. There was another elementary school 3 blocks away that was predominantly white. They had a better building than we did. They had better books and, more updated textbooks. And Our school library had books that still had the stamp from the other school in them because we got the hand-me-downs. And then while I was down there too, I noticed like the one nice restaurant in town closed down. There was a Home Depot in town that closed down, and we didn't know it at the time, but we were in the early stages of the Great Recession. And living and working in a community that was already very low income and very stressed, and then seeing the toll that the recession took there, that's what motivated me to get into government. So, and to get into government with a focus on financial issues, specifically, because again, in the Great Recession, it was clear to me that there weren't enough people in government, in policy roles, who understood how financial markets worked and how economies work. So after teaching in Louisiana, I went and I got my MBA. I went to business school, got a job working in the socially responsible investment field, moved back to Rhode Island. And then after a few years, when the position of state treasurer opened up, because the then state treasurer, Gina Raimondo, was running for governor, I said to myself, okay, this is an opportunity to use my financial experience and my life experience to help the state that I grew up in and that I love. And, I was 31 years old. I had never run for office before, but I threw my hat in the ring and I got lucky. And it's been a challenging but absolutely terrific ride ever since.
Does the fact that our governor used to do your job help the two of you? Does it give her does it help to have her understand what you are up against?
Yeah, no, I feel very fortunate. My relationship with the governor is strong, I'd say, for two reasons. The first is that, she's been a state treasurer, so she understands what we do. And, when I need something or when I am lobbying for something, I don't need to explain the background to her the way I would to someone else, because she's done the job and she knows it. The other thing that was helpful is she and I actually met before either of us were in politics. So when I was, I think, still in business school, and she was working in Rhode Island in the venture capital space, we met. And I've found that some of the most valuable relationships in government are relationships that predate people's time in government. You sort of have, I think, a more easy rapport when you know each other before you were in this, crazy political environment. And so we work very well together.
Is there any really key statewide issue that you wish people were paying more attention to or focusing more time and effort on?
Yeah, that's a very good question. I think for Rhode Island, the thing that we need the most in order to build our quality of life, build the economy, et cetera, is it's still investing in building an educated workforce. This is an issue that others are talking about. Certainly, the governor and the legislature have put some emphasis behind this, but that's really what it's all about. At the end of the day, if you look at the places around the country that are really dynamic, right, that are growing and that are have a high standard of living and high growth rates, it tends to be places like Boston and the Bay Area and the Research Triangle in North Carolina and Austin, Texas. One thing that all of those places have in common is they have good education systems, from early childhood all the way up through the college level. They have great colleges and universities that they invest in. And at the end of the day, the best jobs go to where the best talent is. The places that are really dynamic are not necessarily tax havens. They're not necessarily, places that are the least regulated. They're the places that invest in talent. And in Rhode Island, historically, we were a manufacturing-based economy, and we were slow to make that transition from a manufacturing-based economy to a high-skills economy. I think we've made some progress over the last several years, but we got to continue to emphasize that and continue to put our resources there, because ultimately that's how we'll be successful, and that's how we'll be able to build a standard of living that cuts across demographics and that helps lift everybody up.
Well, hopefully we can focus more on that and less on this pandemic in the coming months or maybe next year. I really appreciate your taking time out of a day that I can only imagine is chaotic and busy and stressful. So many, many thanks, Treasurer Magaziner, for talking to us today. Absolutely. And thank you again for having me. I appreciate it. And thank you to everything that you and your students are doing to adapt to these crazy times as well. We'll get through it together, I'm sure. Absolutely. Thanks again. This episode was produced by Dan Richards and Babette Thomas. Our theme music is by Henry Bloomfield. Additional music by the Blue Dot Sessions. I'm Sarah Baldwin. You can subscribe to us on Apple Podcasts, Stitcher, Spotify, or wherever you listen to podcasts. We'll be bringing you more episodes soon on the coronavirus pandemic as it unfolds from our community of experts at Watson and Brown. For more information about Trending Globally and Watson's other podcasts, go to watson.brown.edu. Thanks for listening, and tune in soon for another episode of Trending Globally.